Now I will tell you what I've done for you. 50,000 tears I've cried, screaming, deceiving, and bleeding for you. And you still won't hear me.
Okay, so I am back, and I will be talking about, I will discuss anxiety disorders in general, and what they involve, and centralizing on panic disorder, a very common anxiety disorder. One thing to understand about anxiety disorders, they affect about 40 million average American adults 18 years or older, and that's about 18% in a given year, causing them to be filled with fearfulness and uncertainty. This is going to be different than what you'd feel around a stressful event like a date or speaking in public. Anxiety disorders last at least 6 months and can get worse if they are not treated. They commonly occur among with other mental or physical illnesses, including alcohol or substance abuse, which may mask anxiety symptoms or make them worse. In some cases, these other illnesses need to be treated before a person will respond to treatment. Each anxiety disorder has a different has different symptoms, but all the symptoms cluster around excessive fear and dread, and the fear and dread is just irrational. Okay, getting on to my spiel on panic disorder. Panic disorder is a real illness that can be successfully treated. It's characterized by sudden attacks of terror, usually accompanied by a pounding heart, sweatiness, weakness, faintness, or dizziness. During these attacks, people with panic disorder may flush or feel chilled. Their hands may tingle or feel numb. They may experience nausea, chest pain, or smothering sensations. Panic attacks usually produce a sense of unreality, a fear of impending doom, or a fear of losing control. A fear of one's own unexplained physical symptoms is also a symptom of panic disorder. People having panic attacks sometimes believe they are having heart attacks, losing their minds, or on the verge of death. And because you cannot predict when an attack will occur, then you will be living in fear of the next attack. Panic attacks can occur at any time, even during sleep. The attack usually peaks within 10 minutes, but the symptoms can last longer. Panic disorder affects about 6 million American adults and is twice as common in women as men. They often begin in late adolescence or early adulthood, but not everyone who experiences panic attacks will develop panic disorder. Many people just have one attack and never have another. And it appears that the tendency to have panic attacks is actually inherited. People who have these attacks can become very disabled by their condition and should seek treatment before they start to avoid places or situations where panic attacks have occurred. This is a good example. A person who had a panic attack in an elevator may want to avoid all elevators, and that could affect the choice of an apartment This could affect the choice of a job or an apartment and restrict that person from doing what they want to do. About 1/3 of people with panic disorder become so housebound and are unable to confront a feared situation, or they are only able to confront this feared situation when accompanied by a spouse or another trusted person. When the condition progresses this far, it's called agoraphobia, and this is the fear of open spaces. I believe its Greek derivation is fear of the market. Yeah. Basically, you're afraid of leaving your house because of danger and unknown variables, that kind of thing. Early treatment can often prevent agoraphobia, but panic disorder may sometimes go from doctor to doctor for years and visit the emergency room repeatedly before someone correctly diagnoses their condition. This is unfortunate because panic disorder is one of the most treatable of all the anxiety disorders, responding in most cases to certain kind of medications or certain types of cognitive psychotherapy, which help change thinking patterns that lead to fear and anxiety. Panic disorder is, a lot of the time, it is accompanied by other serious problems such as depression, drug abuse, or alcoholism. These conditions need to be treated separately. Symptoms of depression include the feeling of sadness or hopelessness, changes in appetites or sleeping patterns, low energy, and difficulty concentrating. Most people with depression can be effectively treated with antidepressant medications, certain types of psychotherapy, or a combination of the two. Like I discussed in the bipolar mania video, you may have a combination of bipolar mania and anxiety disorder or a panic disorder. So, if you get depressed, get diagnosed and make sure before you take the antidepressants that they make sure that they diagnose and make sure you do not have bipolar mania, because that will send your bipolar mania into overdrive, as I stressed a lot in the bipolar mania video. And that's pretty much it on panic disorder. Any questions you have regarding treatment, that kind of thing, I can do my best to answer. Like I've said before, I'm not a trained professional. I'm training to be a professional. Yeah, if you think you have a panic disorder, then please get treated and get your life back on track, because it is seriously debilitating. I knew a person who had well, I would not say she had panic disorder, but she experienced multiple panic attacks, and yeah, it wasn't that great. And it wasn't that great picking her up and hauling her because she fainted. So, yes, if you think you have it, get treated. Yeah, so thanks for watching. My next video, I think, should be due sometime this week. I don't know when. Might do it during class or between classes tomorrow. And I will be covering obsessive compulsive disorder, which is another anxiety disorder. So until next time, keep tuned in, and I'll try to keep bringing on new material. Thank you for watching.